Hi everyone, it's Dr. Herman. Welcome to our AMA, Ask Me Anything. Jenny, our nurse, is going to be moderating this session. She works in the practice with us. She's wonderful. She's getting her master's and she knows a lot about the topic, so she's the perfect moderator. Okay, Jenny, you're on.
Hey, Dr. Herman. So I wanted to ask a question that you love talking about, and it's that if I don't want filler for volume, what are my other options?
Right. Okay, so you're actually right. I love talking about this topic. So, as you know, there's been a trend, especially with our younger patients, to want to seek other options than filler. And that's another whole topic in and of itself of why. But I think the best two options in 2025 are microfat grafting, microfat transfers, otherwise known as, and fat matrix, which is known as Renuva, which is the fat matrix that I've had experience for a long time. So microfat grafting is when I harvest fat from one part of the body and then transfer it to the part that needs the volume. And the important thing, and I tell my patients this, I tell a lot of patients, as you know, Jenny, that I stopped doing fat grafting for the first 10 years of my practice after I started, because we were seeing a lot of complications of fat grafting, a lot of unevenness, overdone, change in shape, and it was just not a good time for fat grafting. That didn't mean fat grafting doesn't have merit, because of course it does. Fat has not only viable fat cells, it has a lot of factors that are trophic for the tissues, for skin. It's regenerative. It has your own stem cells. It has your own exosomes. It was just that we were not doing it perfectly then. We have improved so much in our techniques and in how we do fat grafting. And from A to Z, from harvesting the fat, especially the microfat for the face, as opposed to macrofat, millifat, which we can get into also. But how we harvest it, I use special instruments to harvest for facial fat grafting and eye, around the eye fat grafting, to processing, purifying, and then the injection technique. What do we use for safe injection so it doesn't get into a vessel, it doesn't cause a problem? So microfat grafting for volume, I think, is the gold standard, but of course, you have to have your own fat. You have to have some deposit of fat to be able to do the fat grafting. So we have a lot of patients who come to us and think they have fat, and then when we look, as you know, they actually don't have areas of fat deposit. I found that a lot of our patients don't know that if they're very slim and they have a little bit of smooth fat under their skin somewhere without it really being a little extra, if you try to take too much fat, that it actually can cause a dent in that area. So that's one thing to watch out for, right? What are the other things that we look out for fat grafting? We have patients now, a lot of patients who are, of course, on GLP, GIP injections for fat loss. So you have to know that if you do fat grafting and you are losing weight, whether it's natural weight loss, whether it's due to using protocols and medications, that fat could be lost. There's one question we get from our patients who want to do fat grafting that we get a lot. I know you know what it is.
What if I gain fat for the microfat grafting?
That's exactly right. Everyone asks me this. What if I gain weight because I don't have enough fat for fat grafting? Very slim patients. Well, that's okay. You can gain weight for fat grafting. Just realize if you then lose the weight, the fat that we transferred may also be lost. And we also know that with aging, you get selective fat loss in the face, and we just don't really know how, when we transfer it into the face, how exactly that interfaces. Another long conversation. But those are the highlights about microfat grafting for volume, which is really, in my mind, the best alternative if it's done really meticulously and aesthetically and technically well for volume, other than filler. The one other caveat I will say is that a lot of patients who come to me may be perimenopausal. So if you are a perimenopausal, around the menopause, or just went through menopause, or maybe you're looking towards menopause in a couple of years, and you have a history in your family, your mom, your aunt, someone who gained a lot of weight after menopause, of course you're going to be aware of that in general for your own health. However, if you do fat grafting and you put a lot of fat in a certain area in your face, just be aware that if all of a sudden that happens and you gain 20 pounds, that's going to impact the fat, and the fat, of course, will become more prominent. So those are the things I counsel patients in consultations every day. The other option that is really great other than microfat grafting is fat matrix. What is fat matrix? Okay, so let's talk about that for a minute. Fat matrix is the protein matrix that fat cells had sit in that is purified. There's no fat cells in it, at least the preparation that I use and presently prefer. It's called Renuva. And this fat matrix, when injected where there was fat or there's supposed to be more fat, it actually gets populated with your own fat. Essentially, it becomes your own fat. And that's an off-the-shelf solution. I have extensive experience using it, and I like it. So that's the other option if you don't have your own fat to transfer. It's an office procedure. It doesn't need the anesthesia or lidocaine or harvesting and preparation. So it's definitely a more accessible option. So I hope that answers some of the fat alternative questions.